Good morning to all of you. So today you are going to see or you are going to learn about an important topic in Appalam, which is the mammary gland. I am Dr. Vijisha, Professor of Anatomy. Okay. So today we are going to see the following objectives about the topic. To start with, we are going to learn what is the location and extent of mammary gland, what are the relations of mammary gland, what is actually forming the structure of mammary gland, what are the arteries and veins which is going to supply the mammary gland, which is the nerve supply of mammary gland, how lymphatic system, how lymphatic drainage occurs in mammary gland, what are the applied aspects in relation with the mammary gland, and further about the development of mammary gland as well any related congenital anomalies. To start with a case scenario. A 45 years old Mrs. Kamala came to the OP with complaints of pain and swelling in the left breast for the past 6 months. On examination, breast was immovable. The nipple was retracted. The skin of the breast appeared like that of a skin of an orange. Few lymph nodes of axilla were enlarged. So here you see a case scenario here where a patient, Mrs. Kamala, is coming to you with following complaints and you are examining as a first physician of contact, you are examining her complaints, which is mostly over the breast, and giving the appearance as a scenario of the presentation, presenting a case of the patient. Now, to begin with, this case scenario might be a little difficult for you. So, but I'm just introducing to you to this case scenario, which we'll see at the end. So, mammary gland is in layman term, you call it as breast. So, mammary gland is present bilaterally in both sexes. It is present both in male and females, but in females, it is well developed, and males, it is rudimentary. And here it is male and in mature females. Yes, there is a spelling mistake over here. In mature females, as I already said, it is well developed and becomes more prominent during pregnancy and lactation. It is one of the most important structures of the pectoral region. It is a modified sweat gland which is of apocrine type. Okay. So if you see the location of the mammary gland is located in the superficial fascia itself of the pectoral region. Mostly superficial fascia will have some cutaneous nerves, vessels, fat, etc. But a major functioning gland itself is located in the pectoral region, which you call it as mammary gland. What is it? It is nothing but a modified sweat gland. Okay, here there is a picture of mammary gland both in a female as well as in a male. You can see the difference. In males, it is very, very rudimentary and non-functional, and in female, it is well developed and functional during pregnancy and lactation. Okay, here once again, a cadaveric specimen or a cadaveric dissection is being displayed over here, which will give you the layers of pectoral region. In the first picture, you can see the skin has been retracted, the superficial fascia is cleaned. In the superficial fascia, you see the location of mammary gland. This area is nothing but the areola, a pigmented structure around the mammary gland, you call it as areola, and a pointed structure in the center, you call it as nipple. You can see the mammary gland located on the pectoralis major muscle. Yeah, but this mammary gland, as I already said, is located in the superficial fascia, but attached with the deep fascia covering the pectoralis major, which you call it as pectoral fascia. In the next picture, you can see a well dissected pectoralis major. And in this two picture, this shows the coronal section of pectoral region over here, where you can see the skin, the fascia, superficial fascia filled with fat. Then you can see the pectoral fascia enclosing the pectoralis major muscle. Beyond that, you have the pectoralis minor. Okay, here you can see the cut section of clavicle. Immediately in the inferior surface of clavicle, you have the subclavius muscle. You can see a fascia enclosing the subclavius, pectoralis minor, and then getting attached with the axillary fascia over there. And this fascia, you call it as clavipectoral fascia. Fine. Coming on to the next picture, this shows a side view of breast. What do you see here? You see the skin. Beneath that, you see a more glandular tissue of the mammary gland. Beyond that, all these structures are disposed or is arranged in front of your pectoralis fascia, which is covering your pectoralis major muscle. Okay, so you have several structures holding the glandular portion onto the pectoralis major or pectoral fascia. These extra structures, you call it as stroma. Okay, an actual glandular part, you call it as parenchyma. These two forms the structure, basic structure of a mammary gland. So, mammary gland, as you all know, it is located in the superficial fascia, okay, and it is very much round, but a small portion of glandular tissue from the mammary gland extends into the axilla. It extends into the axilla through a foramen over here. You call it as foramen of Langer. Yeah, this foramen of Langer is a defect in the deep fascia, piercing which the glandular tissue will extend into the axillary tail of Spence. Here, this is your axillary tail of Spence. You can see the mammary gland located in the pectoral region with a extension into the axillary tail of Spence. Mammary gland is being divided into quadrants by a horizontal line, you call it as upper region and lower region, and by a vertical imaginary line into inner and the outer region. So you have got 4 quadrants. So respectively, you are naming it: upper inner quadrant, lower inner quadrant, upper outer quadrant, lower outer quadrant. So this is the foramen of Langer I was mentioning about. So piercing this, the axillary tail of Spence enters into the deep fascia. So the vertical extent of the mammary gland extends from 2nd to 6th rib. Horizontally, from the lateral margin of the sternum to the mid-axillary line. 2/3 of the breast lies in the superficial fascia, which is directly on the pectoralis major. 1/3 of the breast lies in the superficial fascia lying on the serratus anterior. Now the relations of mammary gland. Deep relation, you have a retromammary space, which is nothing but the loose areolar tissue, which is this one. Okay, see, this is the glandular portion of the breast. Behind that, you have a loose areolar tissue just in front of pectoral fascia. You call it as a retromammary space. It is because of this space that the breast is movable to an extent. That means it is not fixed onto the chest wall. Beyond that, you have the pectoral fascia. Of course, you know, it covers the pectoralis major muscle. Then you have the pectoralis major, serratus anterior, and the external oblique. Now, deep surface relations, again, it is retromammary space. What is it? Retromammary space separates the mammary gland and the pectoralis major fascia. It contains areolar tissue. It helps in mobility of breast, and it also provides space for the breast implants. Now coming on to the structure of breast. What is the structure of breast? Breast has got the skin, the parenchyma, and the stroma. So what are the features of breast with respect to the skin? The skin has a nipple, a pigmented area beneath, you call it as areola. In the areola, you have modified sweat and sebaceous glands. During lactation, these modified sebaceous glands will become engorged and then are called as tubercles of Montgomery. These are the tubercles of Montgomery. Now coming on to the glandular aspect of the mammary gland. So you call it as a parenchyma. It is a glandular tissue which secretes milk. It consists of around 15 to 20 lobes. This one thing you call it as lobes. Okay. Similarly, you will have 15 lobes, 15 to 20 lobes arranged in a radial manner. Then you also have something called as lactiferous duct and the lactiferous sinus. See here, you can very nicely visualize the radial arrangement of the 15 to 20 lactiferous lobes. These lobes are drained by a duct, you call it as lactiferous duct. These 15 to 20 lactiferous duct will meet at a point which is at the nipple. All this 15 to 20 lactiferous duct will narrow down to the nipple, which is causing its a raise at the level of nipple. Okay, and these lactiferous duct, before it enters into the nipple for its termination, it bulges or there is a dilatation before its termination. This dilatation you call it as lactiferous sinus. This lactiferous sinus is a pouch or a space for the already secreted milk to accumulate. And when the baby starts sucking, it is squeezing the lactiferous sinus and then drinking the milk. These are few of the lobes. Lobes, lactiferous duct and lactiferous sinus, everything point on to the nipple. Now we'll read about the stroma, which is also for forming a structure of mammary gland. Stroma, it forms the supporting framework of the gland. It is partly fibrous and partly fatty. The fibrous stroma forms septa. We call it a suspensory ligament of Cooper. This fibrous stroma anchors the skin and gland to the pectoral fascia. This stroma is absent in your nipple and areola. See here in this picture, you can very nicely appreciate the skin, the parenchyma, which is the glandular part. Then you can see the supporting framework, which is nothing but the stroma. And the deep relations, which are pectoral fascia, retromammary space, and the pectoralis major. So now the arteries, the internal thoracic artery, the lateral thoracic artery will supply the mammary gland, and the axillary vein, and ultimately it is draining into the superior vena cava. So the nerve supply to the breast is derived from the anterior and lateral cutaneous branches of 4th to 6th intercostal nerves. The branches of intercostal nerve passes through the deep fascia covering the pectoralis major muscle to reach the skin, including the breast in the subcutaneous tissue overlying this muscle. Now, lymphatic drainage of breast is very, very clinically relevant. Why? Because there is a condition which is very, very commonly affecting females, which you call it as carcinoma of breast. Carcinoma of breast can also occur in males, though the mammary gland is rudimentary. So the cancer occurring in one side of the breast can migrate to the opposite half or to the distant region via lymphatic drainage. That is why we need to know much about the lymphatic drainage of breast. So breast is drained by the lymph nodes and the lymphatics in and around it. So you have parasternal group of lymph nodes, you have axillary group of lymph nodes, supraclavicular group of lymph nodes. The arrow shows how the lymphatic drainage is done. So the lymph from the breast goes to 75% of the lymph will go to the axillary group of lymph nodes. 20% of the lymph will go to the internal mammary or parasternal lymph nodes. Then there are around 5% of lymph will go to the posterior intercostal lymph nodes. The lymph also drains into the subdiaphragmatic and subperitoneal lymph plexus. The lymphatic vessels are divided into two, superficial lymphatics and deep lymphatics. Superficial lymphatics will carry or drain the skin except nipple and areola. The deep lymphatics will drain parenchyma including nipple and areola. So here again there is a picture of breast in its quadrants, and the next picture will show you the flow of drainage, lymphatic drainage of the mammary gland. So something about a clinically applied part of anatomy for mammary gland, which you call it as carcinoma of breast. So what is that? Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cells divide and multiply in an uncontrolled way. The breast cancer is cancer that develops in breast cells. Typically, the cancer forms in either the lobules or the ducts of the breast. Yes, so CA breast is usually affecting the lobules, especially the lactiferous ducts. Cancer can also occur in the fatty tissue or the fibrous connective tissue within your breast. The uncontrolled cancer cells often invade other healthy breast and can travel to the lymph nodes under arms. The lymph nodes are a primary pathway that help the cancer cells move to other parts of the body. So here you see the lymph nodes, how it is draining. Okay, and in the second picture you can see a tumor which is 2 centimeter or smaller, yeah, developing. Here it has become much bigger size, like that of a lemon, and which is larger than 2 centimeter but not larger than 5 centimeter. This shows the progression of the disease. Carcinoma of breast, the most common cancers in females. It affects the males too. Though it is rudimentary in them, it doesn't mean that they escape from this condition. It commonly affects females of 40 to 60 years of age. Most breast cancers begin in the ducts or lobules. It commonly appears in the upper outer quadrant. So usually the commonest site of this lump formation is in the upper outer quadrant. Clinically, the patient will present with a painless hard lump. The breast becomes fixed and immobile. There will be a retraction of skin. There will be a retraction of nipple and appearance of the skin of the mammary gland like that of a orange skin. That is what you call it as peau d'orange. So most of the ladies will have a doubt that what does a cancerous breast lump feel like? It is usually hard to touch, a pebbly surface, commonly located in the upper outer quadrant of the breast, does not move during a breast self-examination. Yeah, these are the few pictures which will show you how does a lump look, how does a skin dimples, what is the change of skin color, and what is the change occurring at the level of nipple. The everted nipple will become inverted. This is a slide which shows you how to examine yourself. Yes, during bath, see, you have to do the self-examination looking into your mirror, lying down or sometimes bending down while taking bath. Yes, and this is the method of self-palpation. You either do it in a radial method or in a spiral method, that is the palpation on your own body, or a vertical method. And as well, you need to examine your nipple and armpits. So, in the previous slide, I have told you that there is a painless hard lump present. Yes, by palpation, you will be able to appreciate it. Then the breast becomes fixed and mobile, retraction of skin, retraction of nipple, and the appearance of peau d'orange. So for all these things, you need answers. Why the breast is fixed? So you already know about the retromammary space, the space between the glandular tissue and the pectoral fascia. It contains loose connective tissue and intervenes between the base of the gland and the fascia covering mammary bed. So normal breast will freely move over the pectoralis major. When there is an invasion of breast cancer, the breast, the glandular part, get itself fixed onto the pectoralis major. Then you have several suspensory ligament of Cooper, which is nothing but the stromal part of the gland. Due to the infiltration of malignant cells, these Cooper ligaments will become shortened and fibrosed. Thereby, the breast will further become fixed onto the chest wall. Then, see here, the right breast is normal. The left breast, you have some skin dimpling. What is it? Larger dimples result from cancerous invasion of the glandular tissue and fibrosis, which causes shortening or place traction of the suspensory ligament. So what happens when the skin dimpling occurs, or when the suspensory ligament of Cooper gets fibrosed, there will be several skin dimpling occurring. In this picture, you see a nipple is retracted. The infiltration of cancerous cells with the lactiferous ducts and the consequent fibrosis result in nipple retraction. And this is like orange skin like appearance breast. How does this occur? The skin giving rise to appearance like that of a skin of an orange, you call it as peau d'orange. It occurs due to the obstruction of superficial lymphatics. Now, which are the other regions where this breast cancer spreads? Breast cancer will spread unlike any other cancers through a process called metastasis. The cancer cells will start spreading all around. Okay, and here for the cancer breast, it spreads around lymphatic drainage, through lymphatic drainage. See, it locally spreads within the breast, regional spread of breast cancer, like in the axillary, through the axillary lymph node, internal mammary lymph node, supraclavicular lymph node, and also through the hematogenous spread, which is through the bone, lung, pleura, soft tissue, and liver. Now, something about the development of breast. Development of breast will occur along a line which is extending from the axilla to the groin, which you call it as milk ridge. This starts appearing in an embryo around fourth week of intrauterine life. Initially, it starts as an ectodermal thickening, then a milk ridge, which is called as a milk line or line of Schultz. It extends obliquely from axilla to groin. Yes, in humans, the ridge will persist only over the pectoral region. The rest of all will get disappeared. If at all you find any extra mammary gland or an extra nipple, you will find only along the extension of milk ridge from axilla to groin. So regarding related with the congenital anomaly, during development, if the normal course is disturbed, then they'll end up in something called as polymastia, polythelia, and emastia. So these clinical conditions are interrelated. Polymastia, this is a condition when there is an extra number of breasts. Polythelia means exceeding the normal number of nipples. Polymastia may occur superior or inferior to the normal breast and could occasionally develop in the axilla or anterior abdominal wall. So this picture shows the breast implantation, which is a very, very well-developed cosmetic surgery. So if at all a female wants to enhance her breast, then there is a silicone implant, which is usually kept in the retromammary space. Most of the ladies who wants this, they go for breast engorgement. Now there is a investigatory technique. Usually it is a radiological technique. We call it as mammography. It is a radiographic examination of the breast, which is one of the techniques used to detect breast masses. The carcinoma appears as a large jugged density in the mammogram. Generally, the skin is thickened over the tumor and the nipple is depressed. This is how a mammogram is taken. So between the X-ray plates, they place the breast tissue, it is compressed and the X-ray is taken. This is an image where you can appreciate a dense opacity over the quadrant, one of the quadrants of the breast, suggestive of some lump occurring in the breast. Then for further investigation, we'll confirm it whether it is a benign or a cancerous lesion. Okay. So I already told you breast cancer affects 40 to 70 years of age females, although in males. But this is Alicia Hunter, the youngest known survivor of breast cancer. Are you all shocked? Yes. You are never too late or you are never too young for a breast cancer. She was diagnosed at the age of 2 years. For her, a mastectomy was done. A total mastectomy was done. So, to summarize, before summarization, let us see few surgical incision of breast. So, given in the inferior breast quadrants when possible because of less vascular supply. So, surgical incisions of breast is given in the inferior breast quadrants when possible because of less vascular supply. The incisions that must be made near the areola or on the breast are usually directed radially to either side of the nipple, which is Langer tension lines, or circumferentially. This is to avoid any kind of damage to the lactiferous duct, which is opening into the nipple radially. Now, as mammary gland is one of the important topic as well as a question, these are the methods which will pose, these are the methods through which we can ask you the form of question. The form of questioning, I am putting it up here for the mammary gland. Either a long question, which will be asked to describe individually in subtopics, or a short notes together like this. Short answers, which is mostly 2 marks, like retromammary space, tail of Spence, foramen of Langer, ligament of Cooper. And long question could be describe the mammary gland. Describe the mammary gland under the following headings like location and extent, important relations, structure, blood supply, lymphatic drainage, applied anatomy. Short notes could be mammary bed, lymphatic drainage of the mammary gland, structure of the mammary gland. These are the modes of questioning for this single important topic. To summarize, mammary gland is a modified sweat gland which is located in the superficial fascia of the pectoral region. Mammary gland, the structure of the mammary gland consists of stroma, parenchyma, and the skin. The parenchyma is nothing but the glandular portion of the structure. Gland consists of lobes, 15 to 20 lobes, which will open up into the area of nipple. Then you have blood supply, nerve supply, supplying or draining the breast. Then you have the lymphatic drainage, which is very, very clinically related because of something called as cancer breast. Cancer breast is one of the common conditions affecting the females. It also affects the male. So CA breast, usually it is common or it presents as a breast painless lump, usually in the outer quadrant. Then as the disease progresses, there are chances for the cancerous cells to metastasis to the opposite normal breast to travel or to spill over the subperitoneal cavity also. There are so many important slides which I have projected, like doing self-examination of the breast. Yeah, all these are very, very vital. It is not only for you. it is it is not only for you, but um, you need to take it forward to the other females also. So thank you for your time, and thank you.